All right. Well, shukran. अपना रूहानी बावा ने अपना रूहानी तबीब Ali Qadar Mola si yari talab karine. I'm beginning my presentation today, which is already a little delayed, but I'll try my best to get everything taken in a given in a very timely manner. अपनो main presentation today, I got a message के presentation कोशिश करूँ मैं कि मैं लिसानो दावत माँ भी बोलूँ, so I'll try my best. मैं बच माँ बोलती रही, but mainly English nikal se. The topic mainly is menstrual irregularities in adolescent girls and adult women. A topic apno ghanu important topic che for the reason ke number one a ghanu common che all over the world. Ane apna Muminin families are also affected by this. Not that Muminin families ma vadare che, but it's there. And in fact, prevalence, its prevalence is increasing. It is just increasing. There are a lot of factors why it is increasing. It is seen in about 6 to 12% of young girls. Olden name for this was PCOD. People still say PCOD. This is polycystic ovarian disease. But it has been changed. It's not D anymore. It is PCOS. And khas karine, I want to make sure that our healthcare professionals do not say PCOD because it's not a disease. It's a lot of symptom complex. So we have to know what is the definition, how do the girls present in a testing hoye che, and what is important su che ke ane treat su kam karwanu anasi su thai sake. I had a picture of the PCOS. I don't know if anybody can see it. I don't know. This is another glitch maybe. But chalo kaini, I'll talk about it, what happens in the ovaries in this situation. Now, before we talk about this condition, let's brush up on our normal. Ki normal su hoye che. When do you know ki okay, the girl is going through a normal phase of development? So you have to understand that menstrual cycles start on an average of age 12 to 13 years. Before that, 3 years before that, there will be breast bud development. And at a very younger age, it's 6 plus, there will be pubic hair development. So it goes first pubic hair, then breast development, then will come the menstrual cycles. Now, across the world, on an average, menstrual cycles are between 12 to 13 years. But depending on the girl's health status, they can get cycles earlier or they may not get until a later time. So menarche median age hoye che between 12 to 13 years. Initially cycle intervals ghana irregular hoye che, and in the first 1 to 3 years, it could be delayed for 6 months. You don't have kai bhi nathi karwanu. And I'll tell you as we go further, when do you intervene? Kiware no kai bhi management karvu pade. Cycles initially can be, this is normal that I'm talking about, that they could be less than 7 days. And then as moti thai, she's in the 2nd year, she's in the 3rd year, cycles become little more closer. So pehla 6 months away, pache 4 months, pache 1 month, 2 months, pache 1.5, pache 2 months. 1 month. Em thai che. Also, just to brush up a little on how the girl presents during a normal menstrual cycle, in the initial menstrual cycles, in the beginning, when she attains menarche, she can go through a lot of mood changes. So mood changes, behavioral changes. It's just, khali itlu samajhvanu, ghar walon ne, ke bhai ana period avana che, ana si thodo su dur sambhaline rehvanu. Very normal, it's hormonal change. They can go through a lot of breast pain, which is very normal. Breast pain vaste, they can take paracetamol je India ma mile and Tylenol here, or you can even take ibuprofen. Vitamin E is specifically recommended for breast pain. Vitamin E ointments bhi aave, vitamin E tablets bhi mile che. Dietary modification for breast pain, meaning they have to reduce their tea, their coffee, they have to reduce high fat, spicy food, ye sab reduce karwanu. They go through migraines, Premenstrual migraines are very common. This is the biggest reason why girls are not able to attend school. School days miss thai. For the older girls, je kaam karta ho, ye logo na work days miss thai. In today's day and age, that should not happen. Okay, they're missing school, missing work because of these premenstrual or menstrual problems. In avaste, che introduction, che medications, che management, che I levan. Ibuprofen and Tylenol, which is paracetamol back home, are very common, very mild. बस आपने overdose नहीं करवानू, भूखा पेटे नहीं लेवानू, otherwise they work fine. Cramps, normal छे, एकदम uterine cramps થાય છે. Ibuprofen works for that. We have naproxen here. We have over-the-counter Midol, Pamprin. If it works with the over-the-counter medications, then you don't even have to go. Ibuprofen and Combiflam मिले છે ઇન્ડિયામાં, તમારે લેવાની જરૂરત બી નથી. ઘણા લોકોને increased urination થાય, increased stool passage થાય. This is not abnormal. It's just a variation how one girl presents in one way, another girl presents in another way. Once the cycle is over, the symptoms are gone. They become very moody, angry outbursts, crying, poor concentration at school. I think a lot may be related to the pain. Itnu pain hoy che ke they are not able to do it. So you logo ne pain medication na sathe school mokalwanu. That's what I would recommend. Another thing, cycle regular che ke nahi, e janwa vaste, we have to know ke the girl, dikrini, the cycle ni gap su che. You know, people tell me all the time, and मैं ઘણું સમજાવવાની કોશિશ કરું. તે કહે છે કે મારી દીકરીને પીરિયડ્સ ચડીને આવે છે, મારી દીકરીને પીરિયડ ઉતરીને આવે છે. I don't understand કે what they are thinking that way. There is no કઈ એવું હોતું નહીં કે ચડીને આવે ને ઉતરીને આવે. You have to know કે તમારો first menstrual cycle નું first date and the second menstrual cycle નું second date ના વચમાં કેટલા દિન છે. For example, if the cycle came on February 9th, and then again if the cycle came on March 9th, that's great. But you have to calculate that February 9th na baad, there is this 1 week, 2 week, then this is 3 week, 4 week. So 28 days when she got it on 9th. But then in let's say in April, she may not get it on the 9th. She can get it on the 6th because this will be her 28th day. So they may say that Mari Dikri was supposed to come on April 9th, but she came on the 5th or the 6th, so Utri Navi. There's nothing like that. You just have to calculate what are the cycle gap between first cycle and BG cycle na vachma gap su hoye. Ena pache જ આપ જાણી શકશો કે whether the cycle is regular or not. Again, before we go into the details of the presentation, let me tell you that the normal menarche, normal time to start menstrual cycle across population in the world is 12 to 13 years. But when somebody is in an undernourished population, underweight girl, health-wise, she's not keeping well, her cycles will be delayed. Or if she gains a lot of weight, her cycles will be earlier than that. And માઓને આ જાણવું ઘણું જરૂરી છે કે દીકરીની cycles normal થઈ રહી છે કે નહીં. And it's not uncommon કે moms don't know that. Let me explain that everything, the entire cycle pattern and the effects of abnormal hormone balance depends on the ovarian production of estrogen and progesterone. But ovary does not work on its own. It works by sensors from the brain. Whatever affects the brain will ultimately affect the ovary and will ultimately have abnormal balance of estrogen progesterone. So a lot of things affect the brain. Mood changes, depression, mental stress, weight, and mental stress that may lead to weight will affect the brain. Now, a vicious cycle bani jai che. They may start with weight gain for whatever reason, and then that led to hormone imbalance. And then the hormone imbalance caused further weight gain. So one thing is feeding into the other. That's how this vicious cycle is set. And we need to break this cycle. So what is not normal now? How do we understand that the girl is going through a menstrual irregularity? If she has had no menstrual cycle by age 15. Need to be investigated. Let's say she had her breast bud development, but within 3 years of that, she's had no menstrual cycle. This is important, very important, that it needs to be investigated. And the opposite of that is cycles earlier than age 9. This again, girl gani jaldi physically ekdam develop thai jaye, they become short-heighted, and it leads to other issues. That's why anybody who's age 8 and developed menstrual cycles needs to be taken, it needs to be investigated by a pediatric endocrinologist. What are the risk factors? Su wajah si cycle irregularity thai chhe. As I had said earlier, one is excessive weight gain, mental stress, and in today's day and age, the schooling system, college, it's pretty stressful. And then, you know, we have to say that girls have also now, khudani nemat che, mollani dua che, ki ghanu hips thai rayu che. It's great, but hips does produce a little stress. And I have moms calling me all the time that she goes through irregular cycles. I'm not able to get her to do her hips on a very timely manner. Target nahi puru thatu. I have to explain to those moms ke ini health pehle aave che. E health khali cycles treat kari lo and let her get regular cycles. That's not the main thing. The main thing is what is causing that irregular cycle. If she is under a lot of stress, it's automatically going to produce. And then on top of that, you add all the medications and get the cycles regular, but her stress has not gone away. So it is a very fine balance. Biju, hereditary. It happens. Mao ne jaldi cycles avi jaye, ya late aave, ya irregular aave. There is a connection. The daughters can have it. Thyroid abnormalities. Anybody who presents with irregular cycles has to have their thyroid checked, because there may be no other issue, just the thyroid. And thyroid abnormalities have, once they're corrected, cycles automatically return back to normal. They gain a lot of weight in this. They also go through mood changes. Poor socioeconomic strata. This happens anywhere. Wherever the health of the child is affected, her menstrual cycles will be affected. How do they present? They present with two types of abnormality. Either they bleed heavy, 10 days or more. They're getting their cycles within 3 weeks. Sometimes 2 weeks ma cycles avi jaye. They lose a lot of blood. Anemic thai jaye che, and that needs intervention. Anemia is not something you want to wait for it to happen. Biju, they may not have cycle irregularity, but they have the signs of hirsutism. Hirsutism no su matlab ke they have thick hair on their chin, they have dark patches on their skin, patches on their neck, on their underarms. They have a lot of hair on their arms, on their shoulders, on their back, which is not a normal pattern for females. That is only sometimes it's the only sign that the moms bring their daughters for. Then obviously I had said before that they gain a lot of weight and they develop a lot of mood changes. So these are some of the clinical presentations. Irregular cycles, as I had said, heavy bleeding or very delayed bleeding. What investigations? When somebody presents to you with this kind of a problem, a lot of times the girls come from their primary care and they have had estrogen, progesterone levels checked. It's not needed. We already know that estrogen and progesterone tell us imbalance much. That's not what you want to test. You want to test their testosterone, their sex hormone binding globulin, insulin, thyroid blood tests, which are done most of the time. And then you have to test for their cholesterol, iron, prolactin, and diabetic tendency, which is a 2-hour glucose test. If any of these are abnormal, it means that this cycle irregularity has actually even affected their metabolic health, which I will discuss what is metabolic ill health. Then sonogram. It's not mandatory. Zaruri nathi sonogram karvu, but sonogram will show how many eggs are present in the ovary at one time. Ovary na andar आपको एक normal ovary should release 1 or at the most maybe 2 eggs at one time. But when somebody has this irregular hormone secretion, hormone imbalance, they have multiple small eggs released at one time. So what happens is that they lose their egg pool for good. So by the time they're ready, they get married, they're ready to have a baby, they have very small pool of eggs left. So પછી એમને પ્રેગ્નન્સીમાં ડિફિકલ્ટી આવે. પછી you have to rule out adrenal disorders. આના presentations કના અલગ આવે, serious હોવે થોડા, and they have very initial onset of very high blood pressure. That's when you have to make sure that we are not missing adrenal disorders. So metabolic ill health, when I said when the hormones, the testosterone, insulin, when all that is abnormal, what does it mean? It means that it's leading to metabolic abnormalities. And 30% of these patients who have this, they have this condition. It leads to weight gain, which can be cause or can be effect. Hormone imbalance na वजह से weight gain tha ya weight gain na वजह से hormone imbalance tha. And khas karein that the weight comes on their waist. That is the weight gain. The place at the waist will lead to metabolic imbalance. They'll have high glucose level. They have a diabetic tendency. They become diabetic earlier in life. They have cholesterol issues, high blood pressure. They develop infertility, difficulty in getting pregnant. And if this is not corrected for years and years of their adolescent age, they are at risk for cancer of the uterus when they are in their 50s or 60s. Very important to remember. Management. What is the management? First line is lifestyle modification. Matlab diet and exercise. It goes hand in hand. Ala kulle hal. Har koi ne diet and exercise. Hair removal, I'll talk about it later. Diet and exercise na sathe, they may need medical management, which are some of these medicines, which I'm going to go a little more into detail. Weight loss surgery is not usually the case for young girls. It may be, but majority of the time it's not. It's usually for adult. So what is the lifestyle modification? Again, diet, exercise. It has an excellent positive effect on metabolism. And bhale ye logo weight lose na kare, but the weight has to be maintained. Constant diet and constant regular exercise, or on an average 3 or 4 times a week has to be done. There are multiple ways to do exercise. I don't know if my pictures are being shown. I don't know, sorry. But there are lots of ways to do exercise. Easiest of all is a walk or a run on a daily basis. This is not our goal. It's okay. I mean, it would be great if we can reach this goal, but it's not necessary. This is important. This is what we want to lose. We want to bring down those inches from 35 to maybe 30 to 28. That would be good, right? Yeah. Medical management. Now, combined hormone pills, which are also called as the birth control pills, also called as the oral contraceptive pills. Moms tell me all the time, is it okay to start my daughter on this? Yes. If she meets the criteria, yes, it is good to start her on the pills. Now, why? If they're bleeding very heavy, or if they're bleeding maybe normal 5 to 7 days, but their bleeding is coming every 2 weeks or 3 weeks, they need to be started on these pills because they become anemic. Ek baar anemic thai gaya, but then they become very weak. So that's important. Metformin, I'll talk about it. Sometimes it is given along with the birth control pills. Birth control pills are also given if the girl has no symptom other than hirsutism, which is what we talk about, the hair loss and not hair loss, sorry, the coarse hair and the dark skin. Ina wajah se bhi hirsutism na wajah se bhi apne combined hormone pills api sakay. Side effects, there's nothing without side effects in this world. And I explain the side effects like they go from head to toe. That's how they will remember very easily. Head, it'll cause headaches. On the face, it'll cause nausea. So you take the pill at night time. But on the face, it can cause mood changes. We have already said that hormone imbalance ma mood changes pehla si thai che. And on top of that, I'm saying that the pills will cause mood change. Well, the pills will probably help in correcting that mood change. Then comes the chest. She can have chest pain. She can have anxiety, nervousness, and she can have palpitations. Matlab, she feels her heartbeat all the time. That these are not comfortable side effects. If these are going on for about maybe, let's say 2 weeks, she needs to stop the pill. She needs to call the doctor. We may need to change the pill. Then next is weight on the belly. The main reason for giving the pill is weight loss. The pills can cause weight gain also. But again, if we are correcting a hormone imbalance, it can help her on the positive side. Then pills can initially cause a little irregular bleeding. You just have to be very patient. It takes about 2 to 3 months to get adjusted to a pill. Jaldi pills change nahi karwani, because again, tame biji pill si pacha adjust thai raha chu. And then the last, it can cause blood clot in your leg. That is a dangerous side effect, but it's very rare. Your leg becomes red, painful, and swollen. That's when you either go to the emergency room, ya pache tame immediately call your doctor, because it can lead to a blood clot in your lung, and that is life-threatening. But it's very rare, very rare. Now, I have said pills which can be given with or without metformin. So metformin is given if somebody is wanting to get pregnant. So you can't give them pills, because pills will actually prevent pregnancy. Metformin works by helping get rid of that excessive glucose. So thai body ma ke there is this glucose and there is this insulin. Insulin is not able to cause the glucose metabolism. So the glucose is rising in the blood and the insulin is not getting attached to it. There's a block. Metformin will release that block, allow the insulin to work on the glucose, and that way it helps in correcting this peripheral blood under insulin resistance. It's called peripheral insulin resistance, and it will help metabolize the glucose. Another thing of glucose, okay, this is the high rise of the glucose in the blood will lead to diabetes. That is the reason why metformin will help, but only with diet and exercise. It has its side effects. You can go through nausea, you can go through diarrhea thai che, pet ma darad thai che. That's why we say ke you just have to take it easy, give yourself some time, start slow, take it after meals, take it once a day, then once the symptoms are over, then you make it twice a day. The next medication that can be given is called anti-androgens, which is spironolactone. This is particularly only given if they have the signs of hirsutism, which is again the coarse hair on the face, chin, excessive hair on the face, and the dark skin patches. This is also a hormone, anasibi cycle irregularity thai sake che. So we have to just give it some time. Agar koi spironolactone leche, so we just have to monitor their potassium, and it can be given with the hormone pills, it can be given without. But if somebody has no cycle irregularity, does not have any weight gain, no other signs of menstrual irregularities, then instead of taking spironolactone, they can just go for mechanical hair removal. Because spironolactone does not correct their internal hormone imbalance. It is only correcting the hair here. And it is a hormone. You're taking a hormone, so you can go through some side effects. Weight loss surgery will come later, but it's not for young girls. It's only later on for adult women. I mean, young girls can go through weight loss surgery if they are such overweight. I'm not saying no, but most of the time it's handled by other methods. So again, brushing up. One is prevention. Janvu, ke change avi rayo che dikrima, which is not normal. Start with diet and exercise. Long-term management, meaning you start treatment, don't stop the pills. give it a full 1 year, then you can stop the pills and see if she's regular. Sometimes you may want to continue the pill till she gets married, until she's ready to have a baby. It helps in her metabolic health, which means it prevents cholesterol problems, diabetes, blood pressure, and then fertility assistance, matlab ki jaware logo ready che, they are ready for baby, but they're not able to get pregnant, then they may need additional help with fertility. Jina andar hame medications apiye to get more eggs made. Now we've completed this topic on adolescent girls. Now we talk about menstrual irregularities in adult women. Adult women na bhi problems same hoye che, but they have additional other problems also. They have this hormone imbalance just like the young girls, but they can also have fibroids, polyps in the uterus, or cancer. The management depends on whether they have they desire children, ya pache bachcha thai gaya and they are done with family. Whether they desire medical, no, I don't want to go for anything major. I just want to go for some temporary management and then I want to have a baby. Or they are done and they say that, no, I just don't want to deal with it and I want to get it done. There are multiple modalities, medical medicine che, a procedure che, which is called uterine fibroid embolization, surgery che, jema tame, I'll talk about it, and endometrial ablation. So hormone imbalance no management is the same, but I'll go into a little more detail about it. So if she has the hormone imbalance as a cause of her irregular bleeding, I'm talking about adult women, in no same che, hormone pills, metformin, but they have this additional hormone IUD. IUD means intrauterine device. It's placed inside the uterus. Hormone IUD से શું થાય કે એમની heavy bleeding બંધ થઈ જાય या कम થઈ જાય. Hormone IUDs are available all over the world, back home in the East also. Here we have Mirena, we have Lilera, we have Skyla, Kylina. They are good for 6 years, 5 years, and 3 years. It works wonderful. It has its side effects. It can cause a little mood changes and weight gain, which again we are tackling weight gain here. But the one thing that I feel that apnama itlu popular nathi because they cause a lot of unpredictable spotting. Spotting thaya kare. तो पेशेंट पूछे आई डोंट नो मैं नमाजी छूं मैं नमाज पढ़ी सकूं मैं रोजा करी सकूं आई डोंट नो द आंसर કેમ કે આ ઘણી અનપ્રેડિક્ટેબલ હોય છે સો मैं પહેલા से हम સમજાવું છું particularly Mirena અને Lileta જે આ મિલે છે they have this unpredictable spotting. It doesn't happen to everybody, but it can happen. But it's a good device. And then if they desire childbearing, then they just have to go for fertility if they're not able to get pregnant. If they have already completed family, then they have the same 3 options, but they also have this option of endometrial ablation. Endometrial ablation is something I want to talk about, that it is done in it's done all over the world. In that, what is done is that it's a small procedure. It's not major. They go home the same day. And what is done is that under anesthesia, we put in a device, uterus na andar, and then with different modalities. This is hot balloon. This is radio frequency. This is laser. This is cold with cold nitrogen. These are the ways where our puri je lining che destroy thai jai for good, for life, and they will never bleed again. 80% of the time, 20% it will fail, but it is a very good modality where they don't have to go for a major surgery and they can have this small procedure done. Ana bhi criteria hoye when the uterus is big or when you have large fibroids like these, you cannot have ablation done. Anu management alag hoye che. But if ablation is done, they don't have any change. We are not removing ovaries. We are not doing any major surgery. And their hormones will be released in the same way as before. So obviously hormone imbalance is there, but they can work on diet and exercise, and at least they're not bleeding heavy. In India, it is not commonly done, but it is done. It's done in Rajasthan, it's done in Gujarat, it's done in Chennai, it's done in Mumbai. maybe not that commonly, but you can always talk to your doctor. I guess I found out with my research that, the failure rates probably with their statistics, they say that the rebleed tendency is high, but the rebleed tendency is not that high over here. And I don't have much information about the mechanism of ablation done in India, but I can talk about US, that it's done very commonly. It is losing importance because now hysterectomy is done in such a way that people have a relatively similar recovery time, but it's still not the same. Then other causes is fibroids. Fibroids means there are large balls of uterine muscle. Uterus na andar ekdam overgrowth hai jaye the a muscle. So when they have this, they have very heavy, painful periods. They bleed so much that they end up actually sometimes requiring blood transfusion. A to treat karvu joe. You cannot ane continue na karaye. Management શું છે ઘણા medical management બે medicine છે Orian Orlissa. It has been Orian has been there for the past 1 year and Orlissa has been there for the past 1.5 years. We use this in our practice all the time and it works wonderful. At least ke agar koi ne aim howe ke bhai I'm bleeding heavy but I cannot have surgery for the next 3 to 4 months, we've just put them on Orian. At least till she has her surgery, her bleeding can be under control. And then they can go for whatever the surgery, which I'm going to talk about. Then this is one procedure, uterine fibroid embolization. Wonderful procedure. Anama, no surgery. Main nahi karti. Gynacs don't do it. It is done by interventional radiologists. So Anama su kare ke it's under anesthesia and same day procedure in the office. They go home the same day. They just completely cut off the blood supply of the uterus. So uterus shrinks. And along with that, the fibroid shrinks. Now, once the fibroid shrink, they won't have the bleeding problem, they won't have the pain. Surgery ma, ya to tame fibroids remove karo, jine myomectomy kehe che, ya tame hysterectomy karo, which is removing the uterus. Agar koi ne bachao nahi jota anymore, they are done, I do not recommend ke myomectomy karo. Just remove the uterus because તમે અગર યુટ્રસ એ લોકોમાં રેવા દેશો ખાલી ફાઇબ્રોઇડ રિમૂવ કરશો તો પછી તો ફાઇબ્રોઇડ્સ પાછા બી આવી શકે. અગર એમને બચ્ચાઓ નહીં જોતા they are done, then just go ahead and remove the fibroid. Remove the uterus. Another cause that I had mentioned in adult women is uterine polyps. Polyps no matlab ki these are tiny little growth in the uterus. They don't cause heavy bleeding, but they cause persistent light abnormal bleeding. Period khatam thava baad bhi 10 बार દિવસ સુધી એ લોકોને સ્પોટિંગ ચાલતી રહે છે. સોનોગ્રામ કરો તો પછી એનું મતલબ કે they have this મતલબ if they have these polyps, their polyps are constantly bleeding. આનું ઘણું simple management છે. We just do hysteroscopy, we remove the polyps, outpatient procedure. It's very simple, easily done, and I think one should get it done. Last cause of abnormal bleeding in adult is endometrial cancer, which is also called uterine cancer. And for this, they need to go to a cancer surgeon. So here we complete our talk about abnormal cycles in girls and adult women. When is the time when the cycles are abnormal, should not intervene? This is what I want to tell you. Under age 15 and after age 45, you intervene kai karvanu only agar bleeding heavy and prolonged hoye che. 45 na baad agar tamara cycles periods delay thai rya che, you leave it alone. And agar under 15 if they are delayed and light, you leave it alone because you got to wait till any hypothalamo pituitary ovarian axis hoye che in the body which has to mature. Again, you intervene only if it is heavy bleeding, but if it is light and delayed, you just observe. Here I complete my talk on irregular menstrual cycles, but I'm going to talk a little about COVID vaccination and risk of COVID infection in pregnancy. So ACOG, which is American College of Obstetrics and Gynecology, recommends every pregnant patient and every breastfeeding mom should get the COVID vaccination. આપનું જે યાનો કોવિડ વેક્સિન્સ છે they are not live attenuated. They are not live vaccines. They are mRNA particles. So they are not expected to cause any pregnancy, any complications on the pregnancy or on the fetus. So we are giving it, our patients have taken it, they've taken it in the first trimester, second trimester, third trimester, but obviously there's not a lot of data out there, but there is no safety concern. Pregnancy, one thing is there, if a pregnant patient gets COVID infection, that is very dangerous. We have seen it, we have dealt with it. Patients have been admitted in the ICU. One patient in my hospital had an ICU emergency cesarean at 29 weeks when she got severe COVID. They go on mechanical ventilation. So pregnancy is considered as a comorbid condition. The risk of COVID infection can be very significant. Anybody who gets the COVID vaccine, both our Moderna, our Pfizer, they are supposed to register on the Resafe safety program. And there is also this vaccine adverse reporting system. That's how we will be able to collect data. If a pregnant patient declines, you just have to honor their decision. I mean, it's not a very comfortable thing to think that, okay, I'm going to get my COVID vaccine in pregnancy, but just to tell you that a lot of patients have taken it. Not known that it would cause infertility. A lot of patients have asked me, hey, I'm trying to get pregnant. Should I take the vaccine? In fact, I would say better to take the vaccine now, delay attempting to get pregnant for maybe a few months. So at least you're done with your vaccine course. That's what I would recommend. There is no data, if a pregnant patient has got her COVID vaccination, if antibodies have transmitted to the newborn. Yet they have not seen that. And no vaccine is available for anybody under the age of 12 yet. In India, we have the Covaxin, Covishield. They are not messenger, they are not mRNA particles. They are live virus, live attenuated virus. And at this moment, they are not giving it to pregnant patients in India. Maybe who are very high risk and immunocompromised, जिन्हें घना बीजा conditions होए छे, diabetes, blood pressure, then it's a different situation. Then they are recommended to consider the vaccination. Otherwise, the OBGYNs in India are not giving it to pregnant patients. Menstrual irregularities after COVID vaccine, it's short-lived. A lot of vaccinations can cause menstrual irregularities. Even a flu vaccine can cause menstrual irregularity. And once the effect of the acute dose is over, then the cycles most likely will return back to normal. So here I end my talk on the two topics, which is menstrual irregularities and COVID vaccination. Is it possible to have regular period with PCOD? Well, number one, it's not PCOD, it is PCOS. And if you are diagnosed with PCOS, then something has to be off. So if your cycles are regular, but you're diagnosed with PCOS, and that means you have hormone imbalance. So whatever is the presenting symptom, you have to correct that. I've been told that there are no time for questions. Presenting symptom, you have to correct that. I've been told that there are no time for questions. Presenting symptom, you have to correct that. I've been told that there are no time for questions. So here I end. I can answer any questions if needed. If anybody has any questions, we'll figure out a way I can answer. Shukar mane mauko milo khidmat no, and खुदा ताला अपना अली कदर मौलानी उमर ने तार से क़यामत तक दराज बने दराज करे. शुक्रन सगला. खुदा हाफिज. खुदा ताला अपना अली कदर मौलानी उमर ने शुक्रन सगला. खुदा हाफिज.